What do we know about the mental health impact of people who've been directly affected by massive and life-threatening bushfires, such as have been happening in Australia in recent times, Victoria, New South Wales and other parts of the country? Well, we've learned a lot since Black Saturday about the factors that make a real difference to people's mental health down the track. People are more at risk if they are more directly impacted by the fires, such as at the time if they feared for their life, or if they were separated from loved ones, or if people lost someone close to them. It might have been a community member that they knew well. We know that people recover better if they maintain good social connections. It's very important to have social support. People are more at risk if they're socially isolated, and people can be a little bit more at risk if they're living on their own. So it can be especially important to look to keep connected and keep in touch with people who are living on their own. That can make a real difference. Social support helps. When people are involved in community organisations in some ways afterwards, that helps if people are actively involved in their local community, but preferably not overextended by their role in community organisations. If people are really overextended for a period of time, then that's not so good for people's mental health. And what that means is the most important thing is that the widest range of people in any community stay engaged with each other, stay connected and be involved in the community and look at what you can do to assist and receive assistance from other people. Stay connected. Look at what you can do to support others, draw on the support of others, but also be careful not to overextend yourself. Most people will recover well down the track. For example, about 5 years down the track, then most people will be fairly well recovered, whether they've stayed in fire-prone regions or left for different reasons. But 5 years down the track, they're likely to be about 20% of people who are likely to have significant psychological difficulties that they struggle with in some way. And that's about twice the rate of the general population. So we know that for a proportion of people, they're likely to experience significant reactions even 5 years down the track. It can help a lot in those cases for people to receive specific types of psychological and other mental health assistance. There are therapy strategies that can help people make a better recovery. But in the meantime, a key thing is social support. So stay connected, but also if people think of what they can do to practically support people in affected communities, that will not only help their physical security, but it also will help their mental health.